Good afternoon. We're here today with the leaders of our County Department of Public Health and Justice Services to provide yet another urgent update on the medical conditions inside the jail and conditions for health care in the Juvenile Detention Center. For more than 2 months, my office and our Director of Public Health and our Director of Justice Services have been warning the Council about the impact of the budget cuts on health care and the contract for health care providers, doctors and nurses in the jail and in juvenile detention. But without this funding, the county will lose the majority of its health care providers in the jail. At the last county council meeting, the council chair said that they would not be voting on funding for health care in the jail and juvenile detention until after the deadline, until after the contract expired. So these warnings are no longer hypothetical, they're real. We have a crisis and we can't wait any longer to see if the county council will do the right thing. We're now preparing for emergency operations inside of the jail for having a shortage of healthcare workers. We have to warn our healthcare systems, we have to warn our police departments, we have to warn our residents in the jail, and we have to warn everybody in the St. Louis region that this inaction by the county council will pull officers off of patrol, will flood our hospital emergency departments, will undermine our courts and our constitutional obligations to provide these healthcare services to people in our care. So with us today, first I'm going to ask Acting Director of Justice Services, Tim Ware, to explain what's happening inside of the jail and what we're doing to prepare for this.
Thank you, Dr. Page. Last Thursday, I sent a letter to the chiefs of police and other public safety partners informing them that on Wednesday, June 24th at 6 a.m., the Department of Justice Services' ability to accept detainees at the jail will be drastically reduced. Without nurses to conduct medical screening, police departments will be required to take arrestees to the hospital for medical clearance before we can accept them. This will pull officers off the street for hours at a time, reducing patrol capacity and response times across our municipalities. The Justice Services Department will need to rely more heavily on 911 in emergency situations, further straining both the hospital system and EMS services. This will also require corrections officers to guard detainees at hospitals, pulling them away from the Justice Center. We will continue communicating with our partner agencies to let them know if we are accepting arrestees based on the availability of medical corrections and their resources. Now I'll turn it over to Dr. Cunningham to speak on the healthcare impacts.
Thank you, Captain Ware. Thank you, Dr. Page. Thank you for being here. I want to be very clear about what the loss of our nurses will mean inside the jail. Under the Constitution, every person in custody has the right to health care that meets their needs. That obligation is not optional, it's required. Without this funding, we will struggle to meet those constitutional standards. Nurses are the backbone of our medical care inside of our facility. They are the ones who assess for withdrawal symptoms, manage chronic illnesses, distribute medications 3 times a day, answer sick call requests, respond to emergencies, recognize when someone is crashing before it's too late, and also build relationships. We physically would not be able to get to all 1,200 residents inside the jail. So we will have to stop them from coming in, which is what Captain Ware mentioned with limiting intake. Here are the consequences that we are actively preparing for. Limited medicine distribution, eliminating routine sick call slips, chronic care clinics, a dramatic increase in 911 calls. We'll have to rely on our EMS and our hospital systems to assist with managing common conditions that we could handle. And most concerning, with limited medical staff, that there's a real possibility that someone could die in custody within days, not weeks, simply because we no longer have the personnel to intervene early, and we will not be able to distribute needed medications on a regular basis. These are not theoretical risks. They are predictable medical outcomes when you remove nursing staff from a correctional environment. Every correctional healthcare expert in the country knows this, and every stakeholder we briefed this morning understands the gravity of what is coming. Behavioral health and addiction care, including our nationally recognized MAT program, Medication Assisted Treatment Program for Opioid Use Disorder, will be halted for new patients. We do not want this to operate this way, but without the necessary medical staff, we have no other option. We will continue to do everything in our power to protect the safety, dignity, and well-being of people in our care. But without the necessary healthcare staff, we cannot meet the standards of care that the law and basic humanity demands. We are preparing for the worst because the council has left us with no choice. With that, I'd like to turn it back over to Dr. Page.
Thank you, Dr. Cunningham. I want to make sure everybody in our community understands exactly how we got here. This is not a recent request. Back in October of 2025, the Department of Health presented its budget to the St. Louis County Council, and in December of 2025, the County Council cut $11 million from the healthcare budget, including $2.8 million for healthcare and corrections medicine, healthcare for people in jail and people in juvenile detention. So I have to ask, did the County Council understand that those cuts would devastate corrections medicine and cause a cascade of impacts across our community? Those consequences are here now. For years, Dr. Cunningham and the corrections medicine staff have run what is essentially a mini hospital inside of corrections medicine, initiating treatment for substance use disorder, for addiction, for chronic medical problems, expanding care, really becoming a national model for how to take care of folks in the jail. And we've had the same benefit in the juvenile detention center. We were just recognized last week, national recognition for accreditation for the healthcare services in juvenile detention. That's extraordinarily hard to receive, and it's extraordinarily difficult to maintain that standard. But with now with these cuts in funding, the lives of our detainees in the jail and in juvenile detention are at risk. And the taxpayers are going to pay much more for health care from hospital bills than they would have for us to maintain the doctors and nurses inside of the jail with the routine and traditional funding. So let me be clear about what happens next if the funding is not restored. Corrections officers will be sitting in hospital rooms and in emergency departments, sitting with patients, providing security for detainees who could have otherwise gotten their medical care in the usual and customary way at less cost in the jail and in juvenile detention. Police officers will be pulled off the streets from patrol to sit with detainees and arrestees in emergency departments to get them examined before they can be admitted into the jail in the usual and customary manner. Emergency departments will be clogged with detainees, arrestees looking for medical care, looking for medical treatment, because that treatment is no longer available because the staff were cut from jail and juvenile detention. So the council's refusal to act on this appropriation to restore these budget cuts will be devastating. And if you believe these services should be restored, if you believe we should be providing health care to people in the jail and in juvenile detention at less cost, then please let your council members know. If you believe we have a moral obligation to provide health care to people in the jail and in juvenile detention, please let your council members know. In the meantime, we will prepare for an emergency plan to do whatever we can with our limited staff in the jail, and we will change the way the services are delivered in our community. And I'd be glad to answer any questions.
Has staff already been reduced? Because I know it's going to be June 30th is the deadline.
Well, June 30th is when the contract expires and the people have to walk out the door or can't walk through the door because we're not paying them anymore. We have to take the next 5 days or 7 days to prepare for something we've never done before, which is provide skeleton emergency medical services inside of the jail and coordinate with emergency services in the community and with the 911 EMS services to respond to codes in the jail. We have to spend the next week training our medical staff and preparing our systems for this new skeleton operation. We can't just have half of our doctors and nurses walk out on June 30th and then figure it out that day. We need to be ready. So we're starting our emergency plan on Wednesday tomorrow.
What happens
Doctor.
if the council approves the funding this afternoon?
Well, if the council approved the money, then we could cancel what has been an extraordinary use of our time to prepare for this emergency, to convene police officers and health systems in our community and prepare for this. But we could cancel all that if they approve it tonight and go on with the usual and customary services and save our health systems and police departments a lot of trauma. But I don't know if they're going to do that. They made the commitment that they wouldn't provide these resources until after the deadline.
The next meeting is on June 30th, so if they approve it on June 30th that night at their meeting, what would happen then?
Well, I guess we would figure it out. We would have spent a week preparing for an emergency plan that we didn't have to implement. We would have been spent a week reducing medical care inside of the jail, and we would have spent a week pulling police officers off the street to prepare for this new emergency procedure and emergency operations limiting care inside of the jail. But you can't run an emergency without training. You can't run a new unprecedented system of health care without planning for it and without training for it. You can't just turn it off and figure it out when the people don't show up. We're going to have to spend a week planning for this, and that's what we're going to do.
Dr. Cunningham, at the last council meeting, Chair Day said she didn't take up the bill for this funding because you hadn't met with Shalonda Webb. Have you met with either of them in the week since?
So let me explain what actually took place with that. So I learned about the meeting at the previous council meeting. There was no communication with me, and I looked at my calendar. They had a meeting for June the 4th, I believe it was. They placed it on my calendar, and so I responded asking to meet virtually, and then the meeting was canceled. And so when I learned about the other activities was when I was watching the council meeting myself, and I saw that they canceled the meeting and they rescheduled it to July 7th. My next follow-up was when they emailed me yesterday wanting to meet tomorrow at 10, and I told them that I'm available all day today virtually to answer any questions. And in the meantime, there's been email communication with me answering their questions. But, you know, this has been before them since April. It was a committee of the whole in which my corrections medicine staff was subpoenaed. That meeting went into closed session, but it was my understanding that some of this was discussed. At this point, and what I've shared with them, they have all of the information to pass the bill at any time. And if there's any other details they want, we can discuss that later on. But at this point, we have to keep our nurses in place, and we have to pass the funding, because without the funding, I cannot continue the contract. And let's talk about everything else afterwards that you want to talk about.
Just to hone in on the timeline with the email there, they reached out on Monday seeking to meet Wednesday, and then just to be clear, you haven't met with them in the last week?
Correct. They have not met with me since I introduced so there has not been a meeting, and the meetings that were scheduled, they canceled. And so I've been communicating an email asking them to, pass it. I've been answering their questions. What they want, the council is committed to this new process that I have repeatedly been vocal about the flaws in this new process. It does not align with actual county operations. And I've also, offered to provide feedback to improve the process. But at some point, you have to understand that your process is broken and is flawed and is hurting people, and you need to change it. So from my understanding, they are committed to sticking to their process and not sticking to saving the lives and helping the individuals over there. And again, I've provided everything in email. You really don't need to meet with me, but if we want to meet, we can. You have everything before you to pass the bill.
And just to make sure I understand the timeline again with the emails, they emailed you yesterday to meet Wednesday?
Tomorrow. Mm-hmm.
Okay.
Yep, to meet tomorrow. Then I responded telling them that I'm available all day today. I would prefer to meet today before the council meeting, and I have not heard a response.
What kind of information are they looking for?
Honestly, one of the questions that they asked, they wanted to know why the health department cannot bill Medicaid. Well, individuals, once they are incarcerated, you lose your Medicaid. That is something that is known. That is why this is a big budget pain point for the department, because we are responsible for every healthcare bill. Majority of our individuals are Medicaid. We have a small percentage with private pay. We're talking about less than 10%. The other thing I actually discussed with the council, I was interested in trying to do some type of billing, but I also need staffing to get a true revenue generation cycle team in place. But for the most part, we're talking about people who, they meet the minimal needs for Medicaid. People who come to us, this is their first time seeing a provider in years. So I've explained it to them multiple times. Even last year, we had a 2-hour meeting in which I extensively discussed, we're relying on contractors. Since the pandemic, you see that the expenses for the health department has increased. This has been my priority talking point for the longest, but I see that healthcare is not a priority of the council.
What do you have to say to Councilwoman Rita Days, who says this is a lack of proper planning, you all did not follow the budget process, and this is in response to the budget that Sam Page put forth that was rejected?
Yeah, so we did follow the process. I think they don't understand when the process is broken and flawed. I think there has to be some type of flexibility there. You put something in place to want to fix a budget, but it's not realistic in how county government run. I think one thing the council, they want to understand operations. Operations sit under the executive administration. It's up to them to appropriate the funds, and it's up to department directors to execute what they give us. So I think at some point it's not a matter of poor planning. They gave instructions and we followed. Matter of fact, they said they wouldn't entertain any supplemental requests until the second quarter of the year. Hence, you see my request come the first week of April, and they still have not entertained it. So these are rules that they put in place that all of us follow, but then they don't follow on their end, and here we are with this disaster that's about to happen.
Who's the contract with?
I appreciate this conversation about who asked for a meeting and when the meeting was and what the rules are. The issue is that a process has been initiated that is failing, that cuts were made to routine operations of county government when funds were available to run county government. This new process of demanding meetings and then refusing to meet, which is what we've had, demanding meetings and refusing to meet, or creating a process that doesn't allow funds to be appropriated in time to be useful, is unserious. This is an unserious enterprise that cuts routine operations of county government like healthcare and the jail when funds are available. There are funds in reserve to pay for this, and sets up a process that doesn't work because the timeline does not deliver funds in time to be useful and in time to prevent disruption of services. So without the money, we can't provide healthcare. And if the council wants to set up a process that schedules meetings after the crisis, or cancels meetings, or you don't show up to meetings that you scheduled, or you schedule meetings on topics that are irrelevant, like billing and chronic tuberculosis care, that's not what this is about. But this is not a serious approach to funding routine services of county government if you demand that a meeting has to happen and then you refuse to schedule a meeting until after the crisis. This didn't happen last week. This didn't happen on Monday. This happened in October of 2025. It happened in December of 2025. It happened in April of 2026. We've been talking about this for a long time, and refusing to address it seriously is why we have a crisis in our community.
How many people come to the jail on a daily basis that are being brought here?
30? I don't know.
Yeah.
About 30?
On average, about 33. On average, we have about 33 people that are booked into the jail on a daily basis, and about half of those end up going upstairs and being admitted, and the other half are released. But all of them have to be seen by a first station nurse and also a second station nurse, and that's to care for them after they get through the first phase of intake.
What organization is contracting the healthcare workers?
I'm sorry, say it
What
again.
organization is contracting the healthcare workers?
So we use Missouri co-op agreements. So there's multiple ones. This one particular is Emergis. But the jail, we rely on multiple different Missouri co-op agreements. We're 70% contracted, so there's a few contracts. This one in particular specifically funds the nurses.
Have you been in touch with the hospitals, and how are they feeling about all this?
Yes, the hospitals are not happy about it because what's going to happen is going to be extensive delays for police to bring someone there for fit for confinement, and then you have people who really truly need emergency medical services. There are going to be significant delays. So the hospital systems are not equipped to handle the additional volume that they will see as well, and that's just with fit for confinement. One of the things I also mentioned too when it comes time to responding to medical codes, all of those are going to have to rely on on EMS to transport individuals to the hospital for proper evaluation. And so our hospital systems are going to be overloaded, and they're not happy about it, and they shouldn't be.
Is it one specific hospital or multiple ones?
Yeah, we use the nearest hospitals that's close. So right now, I mean, the closest ones, SSM, BJC. We use the nearest hospitals to get the individual the quickest care as possible.
Is it just nurses, or are there other types of contract agency workers?
Yeah, we have other contractors there. Some of our physicians are contracted. We also have our paramedics; those are contracted as well. It's just the volume of nurses, makes up most of the contracted staff.
How many contracted staff will be impacted?
So this is 23 nurses that we'll lose, over half of our healthcare workforce there.
So out of 23, half, or 23 is half?
23 is a little over half. We'll be left with about 14 county employees and a handful of paramedics, so about 20 total staffing the adult jail as well as our kids across the street.
Yeah, I would just add that county council's primary role in government is to come up with budget priorities and to fund the critical components of government services. And the council certainly has the power to not fund things. And they have the power to disrupt public safety and healthcare in the jail. And if they don't want to fund healthcare in the jail, then we will do what we can with what we've got. But it's an unfortunate situation. It's an unfortunate medical emergency to take care of these folks when the funds are available. We just need to get them released. Any other questions?
Just one. So county council members have said that a part of the reason for some of the budget cuts to the jail, particularly this year, is due to them assessing how the jail has spent its budget in previous years, and they said that they decided to cut back pretty much because they were underspent funds. Now, I don't know if that's what was shared or if that, pertains to medicine, the medical department at the jail. But what reasons were given? Like, why was it cut?
The reasoning for the reasons that I have heard for the cuts in the budget across the board were that from the council members were that they didn't understand what they were doing. Other than that, it's just an unserious response. Unspent funds is an unserious response because the healthcare funds were used, and the cuts that they made in the healthcare in the jail makes no sense at all, other than they don't want to provide the service anymore. That's the only explanation. Anything other than that just isn't a serious answer.
Sure. And just on that note, Paula Olday, she's still with you guys?
Dr. Oldag works for the city of St. Louis now in their corrections medicine. She's no longer part of our team in St. Louis County.
Gotcha. Okay, thank you for that. And when I spoke with her a couple months ago, she said that the reason why it's a pain point for you all, and at least the medical department for the jail, I guess the reason why underspent funds isn't a valid excuse in her, perspective is because the jail, that cutting that money out leaves you guys pretty much helpless when you guys do need to tap into that funding. So I guess what I would like to know, generally speaking, is how does that work? Do you guys have funding that sits in your budget, for things just like for contracted medical care that you tap into, I don't know?
Let me summarize your question because I understand where you're going, and I understand why your question is a little bit confusing because the explanation is nonsensical. The explanation that there was unspent funds, what really happened is the council budget policy director didn't understand all the cuts that he was recommending. And to give him credit, he's come back and said, yeah, that was a mistake. We need to put the money back. But the council created a process that put all of the questions of supplemental funding in front of one person, the budget chair. And if that person doesn't want to schedule a meeting or doesn't want to have a hearing on a budget request, then we do without. And if that person doesn't understand the devastation caused by that budget cut, then we do without and we make emergency plans. And that's where we are today. The budget process that started in October of last year, this is not last week, this is not about a meeting that didn't happen last week. We've been trying to meet for months. This is about a process last October and last December, cuts were made that they didn't understand. Money is available for routine operations of county government from our reserve funds, and they've created a process that makes it very cumbersome by these new rules that makes it very cumbersome to release funds, and that power to release those funds has been given to one council member by the rest of the council. And if that one council member doesn't want to have a meeting, go to a meeting, or have a hearing on a budget request, then we will do without. And that's what's happening today. We're going to do without, and we're going to make emergency plans unless the council decides to release the funds.